Well, the time is 8 o'clock Eastern. I'm so glad that you join us, whatever time it is where you're working, and thank you for carving out an hour today to learn along with the rest of the Circle of Cleft Professionals. And if this is your first time logging in, we're grateful to have you, and we'll look forward to hearing from you, hopefully, in the question and answer discussion that will happen after our presentation this morning. If this is your first time, just as a reminder, the Circle of Cleft Professionals is really around this idea of facilitating collaboration and networking among those people working with cleft, either in countries like Canada, the US, UK, and also in low and middle income countries, and with a real interest in seeing what cleft care looks like and what comprehensive cleft care in particular looks like in some of these contexts. And so our goal is to support one another in growing in implementing comprehensive cleft care around the world. So today, our agenda, first of all, just a quick update on where we are with the Circle of Cleft Professionals. In a second, I'll introduce you to Dr. Cate Crowley and Pam Sheeran from Smile Train. And in the presentation that they're going to bring this morning, we'll have some time for questions and discussion, as I mentioned. And then talk a little bit about where we go from here, including our next webinar on early cleft care and training healthcare professionals. We'll just quickly, where are we? 141 members, 25 countries, over 10 specialties, and we're delighted that you joined us today. Without further ado, you'll see on this list of charity supporters, one of them is Smile Train. We're delighted to have Smile Train as an official sponsor of our work here at the Circle of Cleft Professionals. And today, we're delighted to have Cate Crowley and Pam Sheeran walk us through a little bit about their learning around building capacity internationally for speech therapy in post-cleft repair, both some of the outcomes that they've seen and the challenges that they face. As many of you will know, Dr. Cate Crowley is a professor of practice and program director at the Teachers College University, an extensive history and working with cleft as a speech pathologist. And Pam Sheeran is the vice president of comprehensive cleft care at Smile Train in New York. And so we're delighted to have them this morning, at least this morning here in Toronto. And I'll pass, without further ado, the baton over. I think Pam's kicking us off. Good morning, Pam.
Good morning, everybody. Thank you so much, Hugh, and congratulations on just how the Center of Cleft Professionals has really kicked off. All of the sessions have been extremely interesting. It's been helpful, I know, to many of our global partners and to the Smile Train team in New York and also around the world. So thank you. And thank you for this wonderful opportunity. Cate really is our, Dr. Crowley is really the expert here who's going to be talking about challenges that she's seen in her experience over the years and some of the innovative and effective solutions that she's come up with and worked with our local partners more recently in order to build capacity around cleft palate speech. But before she gets started, I would just like to give some context around why we are coming together, like why myself and why Dr. Cate Crowley are here to present on this important topic. So if you don't mind, Cate, and Kate's driving the slides, so Cate, next slide. Smile Train, as you all know, I'm sure around the room, we are a cleft charity focused singularly on children and families affected with cleft palate. And when we were founded in 1999, arguably our programs were really focused around safe, high-quality surgery. We had grant programs to support the cost of surgery at our local partner hospitals, education and training grants for anesthesiologists, surgeons, nurses. We had awareness grants around surgery. Again, I'm sure as many as you all know. And Cate, if you don't mind clicking, but as the years went on and we listened to our local partners, we listened to our field staff, we looked at the outcomes of our patients. As you all know around the room, we came to realize, it's not really just about surgery, and we need to be able to actually offer a much wider range of grant programs to support children to truly have their full smile and full opportunity. As many of you know, all of you know, assessments and treatments on comprehensive cleft care services are necessary throughout their infancy, childhood, and adolescence into adulthood, and we need to have programs that accommodate that. So Cate, if you don't mind, next slide. So about 10 years ago, so 10 years into our existence, we began to pilot grants around speech therapy, nutrition, orthodontics, and then officially 5 years ago, we changed our mission statement. So it's not just around cleft surgery, but around comprehensive cleft care. And now we have this wide menu of grant programs that are available. We have standards and guidelines in place for each grant program, but then we allow our global partners to submit budgets, proposals that offer them flexibility to administer the programs in a way that makes the most sense for them locally, where they can locally look at their challenges and come up with solutions, look at examples from our experts like Dr. Cate Crowley, and again, find solutions to offer the best quality comprehensive cleft care. So Cate, next slide. So today our programs have spanned more than 85 countries. We work, as a reminder of our model, we work through empowering local cleft teams so that children can get access to care locally. We right now in our network, in our online medical database, we have about 2,100 cleft professionals registered. That includes surgeons, speech therapists, orthodontists, registered in the system reporting treatments, and they're working across 1,100 hospitals. So Cate, next slide. And if you just click one more time. And our model really lends itself to, because of our model is local, the idea of local and local, empowering local doctors and medical professionals, cleft team members. We have the opportunity to identify these challenges early on and also look and also identify opportunities. And so these two graphs are from our partner survey that we do every year. We have usually around 75% or higher response rate of our global partners. And the first pie chart shows that our partners report that of cleft palate patients, more than about 2/3 of our partners say that they can follow up with more than 50% of their cleft palate patients. So the idea that, or in many of the places where we work, children don't come back for follow-up care, it could be impossible to offer comprehensive cleft care. It's actually not the reality on the ground. Yes, there are challenges for follow-up services, but we can find solutions and we can innovate around them. And our partners are reporting they do actually have more than 50% of their patients that are able to come back for follow-up care. And then the histograph on the bottom shows us that in our last year's partner survey, the need and the craving for these programs is there. More than 70% of our partners identified speech therapy as their #1 comprehensive cleft program that they want to focus on and develop in the years to come. So with that, I'd like to turn over to Dr. Cate Crowley. Thank you so much, and until soon.
Good. So let's see, I'll start the video. Excuse me. Start the video. Let's see. There we go. And open it up. Okay. Hi, everybody. It's so nice to see some friends there. Hi. So I'll just go through some of the work that I've been doing. So it was framed as challenges and solutions. So of course there's a lack of trained speech therapists in many low and middle income countries. And here we go, excuse me. So one of the solutions, which is not terribly effective, is to import SLPs, which some places do when they bring in someone on a contract. You can offer intensive short-term cleft palate speech clinics, develop the SLP, SLT university training programs, and then build capacity with interested professionals already working with Smile Train partner teams. And so I'll talk a little bit about some of these. Of course, I'm a university professor, and teach a woman to fish is the way to go, so that people can continue to fish after we leave. So one of the challenges with developing university programs, it's this high cost, and with so many other needs in the countries where I work, it's very challenging. It also takes a long time to develop quality programs, as those of you know who have done that. You know, I always talk about a 10-year commitment when I start to do this kind of work. It's hard to get permanent faculty or mentors, and once people graduate, there's often no jobs or few jobs or very low pay. One bright spot, there's several bright spots around the world. One is at the University of Ghana in the master's program. There's been an Australian woman, Karen Wiley, who lived there for about 4 or 5 years with her family. And then there's 3 lecturers who are fantastic, who are in this picture. This is the first graduating class. This is the second graduating class. They'll be graduating in 2020. So Ghana will go from having just 5 speech therapists to 220 speech therapists. Smile Train has been funding the lecturers who come in with the expertise in cleft and who work with, especially Nana has that expertise, to make sure that the students are aware and have the competency to provide cleft palate care. Another big challenge, and there's other programs. There's a wonderful program in Togo where a lot of Francophone professionals have gone to become speech therapists. The University of Toronto and Transforming Faces are working with the University of Addis Ababa for their master's program. Uganda had a program. So there's programs all over Africa in many parts, and those are important to support. We're doing some work in Nigeria in January with the two Nigerian speech therapy programs to help fortify their cleft palate area. So another challenge is the lack of available information on how to address cleft palate speech issues. So we've developed this 5-day in-country intensive cleft palate speech trainings. In the morning is teaching, engaged sort of teaching, and the afternoons is that direct clinical application. So we ask for 10 to 12 patients with repaired cleft to come for all 5 days, and they do. And so the people who are being trained can actually apply what they're learning in the afternoons, and they can see the patients get better. And we have a lot of supervision for that. We've done it in Colombia, Ethiopia, Quito, Lima, in Ghana, in Manila. We also, actually, the very first one was done in Guatemala, and it was done, Operation Smile asked for that. So we did it in 2012, and we've built on it since then. Cameroon was the first French one. Abuja, Nigeria. So one of the problems was we found how do you kind of get people with a basic foundation? So people would come to the 5-day trainings without the basic knowledge of how sounds are formed, anatomy, physiology, basic knowledge of cleft palate speech therapy, or just what speech is. And so we created this online course that they have a 75-question assessment that they have to do. And here's a short video of.
Hi, my name is Cate Crowley, professor of practice here at Teachers College, Columbia University in New York City. This is a short video showing our online free cleft palate speech and feeding video tutorial. Thanks.
You know, we know it from what she just did. She created sound. Now she can create every single sound. And all we need now is speech therapy. As you will see in this course, teaching is closely integrated with real-world examples of sets and treatments and choose for children and adults born with cleft palate. This has some focus on international and multilingual practices because it's developed also people in high-resource countries, the U.S., and also for people living in communities where few and any resources are available for cleft palate speech and feeding. When you finish the course, you can demonstrate your knowledge and skills through the online multiple choice assessment. If you pass that with 80% accuracy, a certificate of completion will be sent to your email. We challenge you to pass that test. This entire course is available at leadersproject.org. I hope you find it useful in your work.
Okay, so that is what's interesting is to see, and in the United States, 80% of people graduating from their master's program in speech language pathology do not have a course in cleft palate speech therapy, and people are doing this course, many in the United States, so that they get some knowledge base, which is not what it was intended for, but I'm happy that they're using it. So we have the course in English and in Spanish, and we have a French one that the French course is just about, oh man, I would say it's 80% there. And that should be done definitely within this academic year. People get this certificate, and the certificate is important in that it shows that they have actually acquired some foundational knowledge. So there's 55 questions, multiple choice kind of, if they've learned from the videos. And then there's 20 audiovisual questions to see if they've developed any of the perceptual skills that you need to be a speech therapist in cleft palate. So how do we scale up these cleft palate speech therapy trainings? And so we have the Train the Trainer course, and that's also at leadersproject.org. It's all there for free. It has all the videos, it has all the PowerPoints, it has all the role playing, it has all the resources you need to do this. And trainings have been completed by local professionals, so not who've been trained or who had the training in a number of countries, and most of these countries have had multiple train the trainer offerings, so that's how we are scaling it up. Certainly done in Kenya, Nairobi, and Addis, Accra, there's Nana Uso. But it's been done in many places. Another challenge is the need for ongoing mentoring. So that's what we found, they need mentoring. After passing the course and completing the institute, Smile Train has been very effective, a great partner in providing funding for the mentorship, as has Transforming Faces in Addis Ababa. So we've been doing questions through WhatsApp, and different ways people send questions and sometimes videos to asking what to do. And I love that now, instead of me responding or one of the SLPs that I brought over to help me do the trainings, the participants are responding. So this is one in Kano in northern Nigeria, Smile Train partner. No, that was Abuja. This is Kano. This is in Ghana. This is in Addis Ababa. These people were part of the undergraduate speech therapy program that Transforming Faces put together. And then, of course, speech therapists need materials in the local language. Every language is different, and every time we work in a language, we have to think about the various characteristics, especially of the speech sounds. So we have created materials in the local languages for the hierarchy of speech therapy. And this was an interesting project I did with Transforming Faces. One of the issues one of the characteristics of Ethiopia is English is not widely spoken, nor French, nor Spanish. So we, for various historical reasons, so we created an hour-long, 2-hour-long videos in Oromo and in Amharic, showing how to do the hierarchy of speech therapy, because it would be helpful in their training as they move forward with their university program. So we have all these word games in all these languages, and actually we just added a few more this week. And what languages we use depends on where we're doing a training or where people are trained and how much they're willing to work with me to do it. Here's just some examples. We have them professionally illustrated. Smile Train helps fund that as well, so that it really seems like a game versus just homework drudgery. And the kids really do play this game. Here's when you're beyond the word level, you can go into phrases and sentences. This is a book in Igbo, Italian, Hindi, Amharic, and French. It's fun to work with these illustrators too, I have to say. Well, there's other issues where countries have the profession of SLP. It might exist or very little, but the benefits are not well known. Is it effective? So we create before and after videos, and we also create parent testimonials after the kids have benefited from our work. We also translate the research into local languages. This is something about using non-speech oral motor exercises in Spanish, in French. Greg Loff and Maggie Watson gave me permission to translate it as much as I wanted to and share it. Another challenge is that speech therapy in low and middle income countries is often poorly paid. If people don't know about the field, they're not going to be interested in paying for it, or if they don't know that it's valuable, they won't pay for it. And it's just economically where the value is. So financial incentives are needed to increase speech therapy services on cleft teams. That's one thing we kept finding. And so again, partnering with Smile Train, we've come up with another way of ensuring that these children with repaired cleft palates do get speech therapy. And one is the Smile Train speech grants. Did you want to start from here now, Pam? Oh, hold on. The Smile Train speech grants, which Pam will talk about, and then inviting those people get sponsored to come to conferences so they get connected, they can learn more from the research. And so how do we know whether what we're doing is effective? I think this is you, Pam.
Sure. Thank you, Kate. Wonderful job. So many effective solutions you've been working on for so many years. So back to the original story I was talking about, and how many of you know when Smile Train was founded in '99, our core focus was around safety and quality of surgery. And we had early on an online medical database called Smile Train Express that was created in order to capture patient diagnosis information and pre and post-operative photographs. And quality assurance, data, and grade outcomes. As I said earlier, over time, we realized that wasn't enough. We need to not only look at pictures, we need to listen to audio and video content of Palate patients to see what their speech is. We also need to have similar reporting records for all these other new treatment areas that we begin to support: speech therapy, nutrition, orthodontics, so we could not only assure that there's quality outcomes, also verify to our donors that there's treatments that are happening, which is what can actually fuel growth and scaling of the programs. But back to Smile Train Express, so it's our online medical database. Each of our partners has a unique username and login, and we have on the back end different software, where facial recognition software, which we use to detect fraud, and we also use it in order to link patient records. If a patient goes beyond one hospital in order to get care, we can merge their records together so we can see their continuum of care. And as I was saying, with surgery, now we have a process for speech therapy, orthodontics, and nutrition to check the quality outcomes. It's Cate, if you wouldn't mind going to next slide. And this is an example of a record of a patient we have permission to share that has received their surgery, speech therapy, orthodontics, and there's a little, you can see a screenshot of their video. As time has gone on with supporting speech therapy grants, the video quality, the way that our partners are recording the videos, how targeted they are with the actual videos themselves is improving, and the way that then we can check the quality of the videos, of the treatment assessments and the treatments that are happening is improving. So Cate, if you wouldn't mind going next. And another way that we are trying to work on monitoring the effectiveness of these comprehensive care programs, namely for speech, is we're trying to engage in more research. And this is something that Cate is working independently with a number of professionals on a research IRB applications around effectiveness of the 5-day training course that she spoke about, which Smile Train has been supporting in many of our global partner sites over the years. We also are trying to apply for IRB approval on outcomes of our global partner survey, specifically around speech, and more recently around BPD and access to care. We have this new process of looking at the assessments, the speech assessments and speech treatments in Smile Train Express with the video files. We're looking into how we can do research and publish on what we're finding. And we could also do ongoing research on the mentoring that we're doing as well through our new training programs through speech therapy. Thank you, Cate. Another challenge that Cate wasn't able to get to, but I'd like to mention here, is a challenge about access to essential equipment. And we all are familiar with the idea that some children need to have assessment for VPD surgery, whether or not they need surgery or continue on for therapy. And there are ways that we can detect this. There's obviously perceptual assessments are extremely important. Video fluoroscopy is another tool, and nasopharyngoscopies are another essential way that can empower speech therapists to be able to know what the best course of treatment is for their patients. And we found from talking to our global partners that access to this essential equipment is very difficult. They're expensive. They even break easily. If you do have them, it's access to actually get them serviced and fixed is quite difficult. So Smile Train, 2 years ago, we challenged Stanford University, their extreme design project, to design a low-cost, high-quality, pediatric-specific nasopharyngoscope for cleft palate patients. And we have a prototype developed, well, they do, and we're helping them bring it to fruition. So this could be a great tool for our global partners in order to help empower, again, speech therapists and their speech therapy programs for diagnosing and researching their palate outcomes and BPD's needs. Cate, if you want my next slide. And now future plans, Cate can talk to this too, but we have lots more trainings in the works, lots more mentoring programs as a result of these training programs that are happening that we're supporting. Again, more research on the outcomes from these trainings and from Smile Train Express records. And we'd like to do more around BPD assessment as well, especially as this new nasopharyngoscope equipment hopefully is coming to fruition.
Yeah. Yeah. And the mentoring has been really interesting. And that's something we're building out, trying to make sure that people are developing and continue to hold the competent kind of skills needed to provide good cleft palate speech therapy.
Great.
So there we go.
Thank you, everybody. I think I hope we have a time. I mean, there's lots more detail we can go into many of these different areas. So we hope that now we can put the floor open to questions and we can have more of a dialogue around some of these challenges and solutions that we offer. Thank you again, Cate.
Yeah, thanks, everybody.
Thank you very much, Pam and Dr. Cate. We're so glad to have that brief overview. There's so many topics that we could address, but I'm so glad that we have time this morning to spend really in the discussion, which is really where the rubber hits the road. You know, when we start to think about how we can apply some of what you've been talking about into our own context. We do have quite a few new people on the call today, which is wonderful. So feel free either to activate your video, you can signal, raise your hand, or just send me a note saying you'd like to speak. Alternatively, feel free to type out a question, and I'll make sure that between Becca and I, we'll make sure that gets read and discussed. And if you could just locate yourself, you know, what you're connected to, whether a hospital or a cleft center or a cleft organization, just so we can get a sense of who's on the call when you ask a question. But I know Pam and Cate are both willing and able to discuss some of the questions that have come up today. So I'll open the floor to any questions that people have or things they'd like to discuss further. Debbie, feel free, please start. Oh, I'll just have to unmute you, Debbie. Sorry, 1 second. Okay, start again, Debbie. We got you now. Oh, maybe not.
Maybe not. Hold on, we can't hear you.
Oh, Debbie, sorry, Debbie, your microphone is not engaged. You're not muted. I think it might be just your own setup.
Hola, yo tengo una consulta que hacerles.
Hola.
¿Cómo está?
¿Cómo estás?
Bienvenido. Welcome, Gianna. You have a question for us?
Gracias. Voy a hablar en español porque es mi idioma.
Bravo.
Entonces, tenía una consulta.
Sí.
Yo pensé que lo que vamos a ver hoy día era un trabajo que se va a hacer con los chicos sobre respecto al bullying. No sé si me estoy equivocando. ¿Van a sacar información respecto al bullying?
¿Sobre qué?
Bullying.
Respecto al bullying.
Oh, el bullying. Ah, yeah.
It's a very important topic, but that is not something that we were preparing. But maybe there's something on the dock too that's coming up.
Hoy no, pero posiblemente hay algo que van a hacer, el Transforming Faces, porque es muy importante y lo hacemos en diferentes lugares, porque muchas veces en Colombia, en Perú, y muchos países eso pasa. Yeah.
Great. So the question was just around the sense of the cleft children, especially, you know, who speak differently or maybe look a little bit differently, can be the subject of bullying. And thanks again, Abdon, for if you're following the chat, Abdon from our office has translated the question and some of the answers. That wasn't specifically addressed in our discussion this morning. We will have an upcoming topic around some of those social issues and working with teachers. But I mean, we do have quite a few speech therapists on the call. You know, how have you addressed this idea of you know, the exclusion or the bullying that patients can face or children can face when they speak differently?
Yeah.
How does that connect into your speech therapy practice?
Well, I can just address that in, so I'll just speak in English, right?
Please, Cate, yeah, and then we can.
Sure. So when we work in Colombia, we've found we do a week-long intensive cleft palate clinic in Colombia, in Neiva, Colombia, and we found so many children who no longer go to school at 9 and 11 years old because the bullying is so intense. And so what we've done is we've always, now for the last 5 years, added on a morning where we go to one of the schools where we know there's bullying of one of our patients, and we do a whole thing with talking to the administration and making posters that we leave, and they sign certificates and we follow up. And you know, the kids are just so happy to have someone be on their side, because here in the United States and other countries, it's a big thing, bullying, but there it's it's fine, you know. And so we found that taking some of those materials and working collaboratively with the local schools has been very good. And we've actually gone back and seen the kids at least the kids where the schools we've gone to have become more aware, and they're able to continue to school. But it is a huge problem, we found in our work, especially, well, I've done more work in Latin America. I'm sure it's probably the same all over the place. It's the same in the United States as well. It's just against the law.
Thank you. Thank you, Kate. And thank you for your question, Janina. Another question that's come in is more of a technical question, Pam, for you. Debbie Stells asked the question about speech grants. How does one apply, and what's the process involved in terms of Smile Train's connection to speech?
Great. So typically, if we're engaging with a new center, a new partner that wants to start with a speech grant, we have an application form. But typically, what we say, we have a conversation with the speech therapist who's leading the program. We say, "Where's your training? What is your experience around cleft palate speech?" We have a conversation. If the actual professional who's providing the care is coming out of a recent training, we usually go to the trainer of that program and we get a recommendation as to whether or not this individual completed the course, was able to pass the final exam, or do any of the practicals where they showed and demonstrated their ability to do effective care, that it all went well. So usually there's a conversation there. But if the program has the experience, speech professional knows how to do effective speech therapy for cleft palate patients, we have an online application form which asks them to explain their program, what their needs are. We ask for a budget. The budget can cover anything from their time. So in order to make sure that they have, they're able to be at the hospital and provide the care. Also can go towards the patient's transportation to and from, any supplies they need. If there is a need for equipment around for nasopharyngoscopies, or if it's for the examinations, if they use video fluoroscopy or nasometry, they can figure out what that would be per patient. And usually then they estimate, okay, for 6 months, this is how many patients I estimate that we're going to be able to treat. And usually what we do is we give a certain amount up front. And then after 3 months, we do require 3-month updates in Smile Train Express on how the treatments are going, in addition to the initial assessment. So if the reporting is going well in Smile Train Express, they're actually reporting the cases, then we'll give them the next amount of money they need to then continue for the next 3 months. And then at the end of the actual first grant term, we review what was reported completely in Smile Train Express. We have our external consultants review the quality of the outcomes. We know that a speech therapist cannot be judged on the outcome of one individual patient. It has to be looking at all of their patients. Some patients are more difficult than others. And so if they're not getting results per se in all the patients, that's okay. But is there some progress that's happening? And we say, all right, is this program ready to receive more support? We also require a final grant report at the end of the grant period, where the partner is supposed to talk about their challenges and what solutions they want to offer for the next grant program. And again, we make sure then, if the grant's renewed, that they incorporate those ideas. So Great. Long story short is we have an application online, and if you are interested in applying, or you know a program that should apply, please feel free to reach out to me directly, and I can send along the link.
Thanks, Pam. And obviously the Slack is another place we'll talk about in a second, but if you do have specific questions that are more public for everybody, like that question, it'd be great for us all to hear so we can follow along. And then obviously Pam has volunteered that we can contact her directly if we have a...
All right, and you can also contact me in Slack too. That's a great point. Yeah.
Thanks, Pam.
Thank you. Yeah, of course.
Holly has raised your hand. What's your question, Holly?
Yes, can you guys hear me?
We can.
Okay, perfect. So my name's Holly. I was a student of Dr. Crowley's at TC and participated in one of the trips to Ghana actually in January. One thing that came up a lot in Ghana was not so much related to cleft, but more intellectual disability. There are lots of cultural stigmas about children who have these, and I was wondering, when you go into different communities, how you've tried to tackle any cultural stigmas against children with these craniofacial abnormalities.
Mm-hmm. Thanks, Holly. Dr. Cate.
Yeah, I mean, it's every country has a different slant. Hi, Holly. And I think that we do the anti-bullying where we do that in what we found in Ghana specifically, and I've been going to Ghana for the last 14 years, is there is a great stigma. Over time, we've noticed, because we do every year we collect data from the teachers and who we work with, and we ask, how is the, what is the biggest concern of yours? And they always say stigma, so we've turned it into a question, the stigma about disabilities, and it's very intense. So if a person with intellectual disabilities comes too close to someone's food in a market when they're trying to sell their food, or points to the food, they might even throw that food away, thinking that. So the stigma is quite difficult to and big. But one of the things that's happened is with the internet, and the access to internet over the last 14 years in Ghana has increased over 1,000, I mean, so much, that there's more and more information available and more understanding of disabilities. So it's not just the one person who is in the village in the back of someone's house, but more and more people can read about it and learn about it. I remember we were doing something with Down syndrome, I believe, and a father, we were doing a talk about Down syndrome, and a father in Ghana raised his hand. He said, I thought this was an African curse. And so by sharing information that, I have a first cousin who has a son with Down syndrome, and then just sharing how we work with it. Another thing that happens in Ghana is we're given more wisdom than we actually have. More wisdom is attributed to us than we actually have, just because we're from the West. And so we're often invited to go on radio and TV and be interviewed by the newspaper. And so we always bring our colleagues because, talk about disability and who we know with disability and how we work with disability. And the teachers say that actually has helped. So we see over the last 14 years a big change in that stigma, simply because people can get access. I think that's mainly it. The internet is making a big difference in stigma, certainly in Ghana.
And if I could just also jump in, I mean, this is where with Svaltran's model of empowering local cleft teams, if they've been doing work locally and then have a group of patients and families that they've been working with and treating, for many years, and they can tell a story about, how they're a normal family and how they've needed access to assessments and treatments that are particular to their cleft palate, but then are able to have, go to school and have a full social interaction and have a full life. And that just telling those stories and having that example locally. And you saw the menu of grant programs that Svaltran offers. Our partners can apply for awareness grants where they can spread the word about cleft lip and palate in whatever way that they deem most appropriate locally. And to be able to say to people, to be able to spread the news that this is something that can be treated, and that these children are healthy and happy and not a curse. It's definitely, like Cate said, in certain regions there are certain stigmas that are very unique, but I think universally it's as long as you get the word out. And again, the idea with our local partners, that they are the ones that know locally what's most appropriate for their communities and how to change the stigma.
Thanks, Pam.
Thank you.
And I think that's, again, I saw even in Cate's presentation, the idea of testimonials, of parents who've journeyed along this speech therapy journey. I think, in my experience, it can be quite compelling to see a family that have gone through this process and emerged on the other side, as a way of dispelling some of that bias and stigma. We have Midori up next, and then after that, Suraj in Chennai. So Midori first, please.
Hi, folks. This is Midori from Brazil. I'm an UpSmile volunteer, a speech pathologist. I think all this webinar is just great. It's just what I'm worried about, I'm concerned about. I'd like to know from you guys who are already doing this about the outcomes between when comparing all those approaches. What are you guys feeling that's more effective? I'd like to know what's going on now. I'm sorry that I entered late in this webinar, so maybe it was already discussed, presented, but I would like to know what which approach are you feeling that works better? That's
Okay,
my.
so Dr. Cate came through a variety of different strategies. I wonder if you could focus in on one, Cate, that you thought was having the most promising results so far.
So really, I would say that what we are creating is how to build capacity so that people can really know how to work with cleft palate patients with repaired cleft palates. And so we started in one way with the 5-day training, and then we realized that wasn't enough. We needed that course. So we built in the course, and then we built in the train the trainer, and then we built in the mentoring piece. And so it actually is, what we're doing is trying to figure out how to build capacity in cleft palate speech therapy in a way that is sustainable and that also can grow. And that's working with the Smile Train partners has especially been helpful, because we get to have conversations and see what does or doesn't work. Because the first couple of trainings we didn't have them connected to a cleft palate team. We just chose from the people who wanted to do it, the people that we thought would be really good SLPs to learn this, to add on to their area. But without the connection to the cleft palate teams or the Smile Train partners, we found that that was not useful. So there's been many challenges and we keep trying to find solutions, but it's almost like it's a model that we keep building on as we find the weaknesses and limitations in trying to build this. And one thing that's been extremely helpful is that Smile Train Express, where we can actually see how people are doing as clinicians. Are they making a difference in the speech of those kids? Because no matter how much we train, unless people are making a difference in the speech, we're sort of spinning our wheels.
Right, and then we can we can also use Smile Train Express with looking at, okay, how are the professionals doing the assessments, initial speech assessments? Okay, then that's one area of learning and understanding that we need to make sure the therapists are empowered to know how to do effectively. And then when they do their treatment reports every 3 months in the patients, okay, are the majority of patients actually progressing, even if it's only in singular sound or word only and not in sentences? Is there progress with a certain percentage of their patients? And we can use that to then look at, okay, what are their areas of training do we need to work on for that particular region? And this is where Smile Train, so Cate is on our Global Medical Advisory Board. We also have regional medical advisory councils, which are made up of regional experts. And so we review with them the trends that we see in Smile Train Express, then they can help guide for regional trainings that need to happen in that particular area. And I also want to say that we've more recently tried to come together with the Smile Train Express reporting of speech therapy outcomes and assessments to the palate surgeries. So we have an internal quality assurance system that ties those together so that we're not only looking at the training necessary around speech therapists, but also for the surgeons, which surgeons need perhaps more support with their cleft palate outcomes. And it's a difficult process. And I know I mentioned something earlier in my presentation about patient follow-up and what percentage of the patients come back for follow-up care and to actually even get an assessment to determine what their speech is. But we're getting there. We have lots of work to do ahead, but there's definitely has been progress in the last few years as we've been focusing on the growth of comprehensive cleft care programs and helping to finance it. Suraj is smiling.
Yeah, thanks, Cate. Thanks, Pam. And
I see.
Obviously, as we heard last week from Debbie Sell and Brian Summerlad, that partnership between surgery and speech therapy can be so critical in really assessing the outcomes and how things are moving. And obviously, back to Midori's question, I mean, I think it sounds like there'll be a lot of research emerging from this new, relatively new, expansion in Smile Train Express and having these outcomes assessed into what's most effective, and we'll look forward to following along closely with those research, those of us who are involved in speech therapy and other places. Thank you. So Raj has been waiting patiently, and then we also have a list after that, so just keep checking the chat. Please feel free to raise your hand. We still have a few more minutes, which is great. Suraj.
Yeah, I would like to add, Pam, I'm a proud STX user, and I think we are learning the process of how to upload data. It has refined a lot. We are in touch with our Indian team, and then the learning process is really nice. Maybe over time we will reach the milestone of, to do cross-continent kind of an evaluation, to do a different kind of an evaluation of outcomes. I think we will be there soon. And then thanks to Cate, with small discussions with her, we have developed storybooks in Tamil language, which we shared it with you in last ASHA. Is there a way we can give that as a tool to you, which can add to your the material in variety of linguistic use? You can check the credibility, and if it meets the requirement, we are happy to share the results. I think Professor Rupa will be happy to do that. So
Yeah.
I would like to know whether there is a possibility for that.
No,
Great,
your, your books.
Those are sorry,
your
two
books-
colleagues from Ramachandra and Chennai. Dr. Cate, go ahead, please.
Yeah, thank you so much. Your books are beautiful. They're actually in the top drawer of my left-hand, the top of my left-hand drawer in my desk in New York. I just need to get with you. One of the things, so I'm a lawyer too, and I did copyright law, and I just have to make sure that everybody is signed off on whoever did the illustrations and whoever wrote the book. We just have to get an assignment of copyright so we can put them up on Leaders Project. That's another reason we do all the illustrations. The illustrations, we pay professional illustrators. That's funded by Smile Train and by some private foundations. It's not just so it looks like a game as opposed to drudgery homework, but it's also so that we own the copyrights. Everybody can use, we give everything away, but we can't put it on Leaders Project until I make sure that the copyrights have been assigned to Teachers College so that we can pop them up. You can keep your copyright, but you need to assign us the rights to do it. So it's a technicality, but it's a legal technicality, and I just haven't gotten to it. But I love your books, and I do want to get them up. So,
And
So you want to share?
I'm sure on the Circle of Cleft Professionals, we could share them. And we just updated our medical resources page on our main smiletrain.org site. I'm sure that would be a wonderful place to share them, or even on the Smile Train India site. It's
There.
really important that other groups can learn from your tremendous experience at Sri Ramachandra.
Yeah.
Thank you.
And then one last point, Hugh.
All right,
And
quick,
that-
Suraj.
With respect to the bullying, we have developed a mechanism where we meet the parents, children, and we make sure that we have identified leaders in our project. So they talk about their experiences and how they have overcome. And that is something which has really helped us, because the patients directly talk to the other beneficiaries and get the information and then do. And because we have a very good working with the school system, we are able to address that problem really well. The only problem which we face here was there are a small group of families who are hesitant in allowing our workers, grassroots level workers, to their home, because they think that the neighbors are watching who is coming and who is going. That is becoming a big taboo for them. That is a problem which we are not.
Thanks, Suraj. I think you froze there, but I think we
are looking at other options.
We got most of that. Thank you. And again, I think that came up earlier, that sense of patients talking to patients, families talking to patients, as being a critical way of making speech therapy normal, but also in really encouraging parents and patients to stay the course and continue with the exercises, with the games, with the reading, with the books that you put together. So thank you for that, Suraj. I'll go to Mexico. Carmen Pamplona from Integrate, Hablate and Integrate. What's your question?
Hola, Carmen.
Yes, I hope you can hear me, because
Yes.
I'm in a noisy environment. Congratulations to Pam and Cate about your wonderful program. But yes, I wanted to know, just like Midori, if you have any results about the speech pathologies, the parents, or how are the kids doing with the program?
Well, that's what we're doing now. We have an IRB study approved, and that's what we're doing now. So we should have that material. We should have those outcomes. But essentially, we're going to be looking at the amount of speech therapy that's being provided. We're not yet to look at the quality. We can look at the quality of the 5-day trainings. We can look at the impact of the online course. So we're doing that. That's one of the IRB studies that's in place right now. And but we don't have that to show the impact of the of the capacity that we're building.
Thanks, Kate. So work in progress. And just for those of us not familiar, the acronym IRB stands for?
Well, it has to do with the internal review board. It has to do with the right to do studies with patients.
Perfect.
With
Thank you. Thank you for
And
clarifying.
then Maria Carmen, I'm not sure, were you asking about the outcomes of the patients like with Smile Train Express? Is that what you're asking about as well?
With Smile Train Express, there's different, yeah.
Yes, if you have any results from that.
Yeah, I mean, we are, so our approach has been is looking at it individual per therapist. At the end of the grant period, reviewing, okay, where the strengths of this program, perhaps where there are some opportunities to earn more training. And it's been a more individual assessment. So, I mean, but we've been able to renew every program that we fund. Perhaps there's been one or two programs that need to go on hold until another training takes place. But all the programs are doing well and are having outcomes of their patients, that their patients are progressing. And maybe that's because of their initial, we only fund the programs where the therapist has the experience and can prove that they've done a training or they've been involved in a training over the years in the past and they are able to get effective care. So there is something at the onset that kind of filters out who's able to provide effective care or not. Yeah. But I don't have like statistics I could share with you off the bat on the outcomes of the patients here. I mean, we do want to publish research on how the programs are doing, but we haven't designed anything yet. It's more of an internal tracking tool. But if you have any specific questions about a certain region, or if you have ideas for research, I'd love to talk to you. It's been building in the last few years, as Siraji said. The Sponsor Express records, I think to date we have, I can check how many, we have a few, maybe 5,000 speech therapy assessments and treatments in Sponsor Express. So it's building. And again, if you have any ideas for how we could publish research on it, I'm all ears.
Thanks,
but it's been so far internal tracking tool. Thank you.
Very good. All right. We'll go to thanks Carmen. I'm not sure, New York or Virginia Beach. Where are you today, Ruben? And what's your question?
Hey, good morning. I'm in New York, Hugh.
Hi, Ruben.
Hi, Pam and Dr. Crowley. Thank you so much for this presentation and all it offers to all of us. We're just trying to figure out how to overcome the endless challenges. So we see that you're going through one space and another solution and another solution. I wonder, when you started this path, what was the profile of the candidates you look for in order to start the 5-day course, the additional course, and the trainer course? So out of the cohorts of professionals that you selected or individuals that you selected, which ones seem to have given you the best preliminary results on offering care and impacting the lives of patients? It's, we wish we had speech language pathologists all over the world, and the reality is that's not necessarily true, but we also want to make sure that whoever we train has the knowledge base to really do good work.
Mm-hmm.
Yeah,
exactly.
I mean, I think if you don't mind me jumping in, and then we'll go back and forth, but I think this is it has to be so country specific on who we target for training. For example, in 2017, Kimi, who is our local manager in the Philippines, invited Cate to come and do the 5-day course in Manila. And so she organized a number of paraprofessionals to come to the training. Mothers, I think, were there. Cate, who else was there? It was not
speech pathologists, but they were special ed teachers. They were social workers who worked with Smile Train partners in different parts of the Philippines. And
when we started the training, we thought this was great because these people will be wonderful for work in the communities, in more rural areas, to training parents and how to do effective care at home. But when the training started, we realized, actually we need to be here in the Philippines. There is actually a group of trained speech therapists. There's at least 2 university programs that graduate trained speech therapists. They need to be the ones actually receiving the training, so then they could train more speech therapists, and that they could actually be the ones leading the more formal treatment programs in Manila and other major cities. So that's where then, Cate, you shifted gears when you were on the ground. And now we have actually partnerships with the speech therapy master's programs in 3 of the major cities, and they're training the professionals to perform the formal assessments and treatments. And then a few of them are doing the 5-day training course that Cate's designed for parents and paraprofessionals in the more rural areas, so that can actually get to patients, so that there's just everyday care for them happening more closely at home. But the programs that we're actually funding for assessments and treatments are for the formal speech therapist. That's the Philippines, but because we thought maybe at first it could be the paraprofessional track there, but then realized, no, it has to be the formal therapist track. And you have to really do that background, have that background understanding and knowledge in each country where we began the trainings. You don't want to isolate or even offend the speech therapy community. You want to work with them and engage them to be able to be targeting cleft palate patients, and then empowering those that in the community in order to do the work in more further out areas where they're not based.
Great.
That's my perspective, but Cate, I would love for you to obviously.
No, definitely. That was so interesting when we went to the Philippines, because I didn't know, but the speech pathology programs there are so strong that I started the 5-day training, and by day 2.5, I was co-presenting with the speech pathologists because they were so knowledgeable. And I will never have to go back to the Philippines unless I want to go to the beach for a vacation, because it's extreme. The programs are so strong and they've just taken it on. But one of the things in the beginning that we had difficulty with, we would invite strong people who were speech pathologists, fonoaudiologists, orthophonistes, whatever it was, and if they weren't connected to a cleft palate surgeon or a cleft palate team, we found that we couldn't get them to use that training. So we now want to make sure there's either we can connect them or they already are connected, and that's what we do, a smile training with the partners. And the online course was developed because we just had so much trouble with people having so little knowledge. So they have to do the online course. I remember in the Philippines, there was a woman who was a social worker with one of the teams in one of the small islands, one of the Smile Train teams. And she said it took her a month to pass that course. But we have, I think there's 10 different assessments. So part of the learning process is in doing the assessments. We also had a group in Guatemala, in a rural village. There was a lot of cleft in that one village, and the parents decided to just keep doing the Spanish course till they passed it. And it took about 2 months for them to pass it, but it was really fun when they did. So that basic thing with the online course is important for people to have finished before they come to the 5-day training.
So then that makes sure that everybody's in the same playing field. And one more point, Ruben, I think I was going to make, so it depends on the country, obviously. And we want to make sure they're connected to cleft surgery programs. But also, I was something I had a really good train of thought. I'll email you later, Ruben, but it's a tough, I was just saying in West Africa, some of the trainees have actually been surgeons themselves. Yeah. And they have been very dedicated. And this is in this place where there aren't many speech therapists, so you have to go to alternatives. And they have been very effective and very dedicated to offering care.
Thanks, Pam. Thanks, Cate.
Thanks.
We're really running short on time, and we've got a long line of questions. So we'll have to think about how to keep moving this forward. But Debbie's cell's been waiting, and so I'll just jump over and grab her comment, or her piece. Her microphone isn't working as well as it could be, but it really comes back to this idea of the multiple countries. So. How are you planning to deal with the assessment in so many different languages? The speech sample is so important as a variable in outcomes, and that's from Debbie Sell.
Well, that's where we have regional medical advisory councils, where they're experts in each region that we empower, and we're asking them to be the reviewers of the assessments and treatment records being reported, so they can tell us in the local languages, how things are progressing. And our assessment form and our treatment reporting form is translated in 7 languages. And then we have, I think, up to 20 samples of how you do the recordings in local languages for the assessment and the treatment update as well, on syllables and sentences. So we definitely understand that challenge, and we work through that by empowering the regional experts to be the ones to review the cases, and also by making sure our forms are adaptable for many languages.
Great, thanks, Pam. There was a question from Professor Rupa from Ramachandra about the outcomes and skills developed through your 5-day course. I think you touched upon that in your presentation. I'm wondering if that's something that we could post. Just as, in light of time, I want to be really conscious that the people have given us an hour. But I think that's something that would be quite interesting to people. Cate, if that's something that could be posted, just a general overview of what the 5-day courses address. Is that possible?
Sure, of course.
Thank you very much. That's great. Well, I do want to honor people's commitment of time. We've come to the hour and we've still got lots of hands up, lots more to discuss. So Becca, if we could just shift over, I want to thank in particular Pam and Dr. Cate Crowley for their presentation today. Obviously, there's a lot more discussion than even a half an hour that we could fill, as Smile Train has exposure in so many countries around the world, and speech therapy, as we know, is a really hot topic in terms of post-palate repair. We will be posting this webinar, so if you do have colleagues who are interested in understanding better Dr. Cate Crowley's or Smile Train's approach to speech and what's coming, the last webinar that we posted from Debbie Sell and Brian Summerlatter on BPI has gotten a lot of traction online, so there is a chance, especially even if English is not your primary language, to be able to go through and view it again. And we'll also be encouraging you to post things like the overview of the 5-day course or other questions there. And as Pam mentioned, there is a possibility to get some responses publicly or just to reach out individually around what Smile Train's doing in terms of speech therapy. So Slack is the #1 discussion forum that we're trying to support here at the Circle of Cleft Professionals. All of you will have access to that if you've applied, and we'd love to see the conversation continue. So up next, we haven't talked much about early cleft care and cleft nursing in particular. So we're grateful and delighted to have a cleft care nurse from Bulgaria named Kostadinka Bojikova. Sorry, my Bulgarian is not strong. Gareth Davies from European Cleft Organization will be joining us next month. So about a month from now, mark your calendars. There'll be no more time changes as far as I know. So the time you see should be the time you get. And then into the new year, you heard questions from Professor Rupa and Suraj from Ramachandra University, and they'll be presenting a little bit more about some of their work with remote speech in January. So we've got a really exciting program to continue to present, and especially of late, with some topics that are especially of interest to speech therapy connected people and professionals. As we know, as an integrated field of comprehensive cleft care, there is interconnection between surgery, between speech therapy, between social work, and the bias we heard today. So it is interesting, obviously, to all of us around some of these topics moving forward. And again, thank you for joining us. We're grateful to have you. If you have any questions, you can send an email to info@cleftcare.org, and we'll try to sort that out. And I'll also be spending some time following up on some of the questions that we didn't get to this morning. So huge thank you to Pam and Cate. Thanks so much. And we'll look forward to seeing everyone the next time.
Thank
you.
Bye,
Thanks, everybody. Bye.